Hi, this is Dr. Stephen Bracci, VERVE Medical Cosmetics. How do you choose your cosmetic injector? What do you look for? Well, check first and foremost that injectables are their main focus or their main job. All too often, providers provide injectables on a certain morning of the week, and it's something to pay attention to. You ideally want to have somebody that does it on a full-time dedicated basis, and they're not doing other medical specialties, and they're not doing surgeries. They're just relying and focusing on injectables. They should use a variety of injectables, not just the all too common hyaluronic acid fillers. Brand names you may know of are Juvederm, Restylane, Voluma, Versa. These soft fillers are easy to inject, but if you rely only on those, you tend to get an over puffy appearance and it doesn't look as natural. I personally, when I'm treating most areas in the face, rely on the firmer fillers such as Radius and Sculptra because they give you a better definition and it's much more natural looking. It doesn't hold water as much. Make sure that these injectors can treat all areas of the face. Somebody who's really truly an artist and a full-time injector should be able to treat everything from the forehead down to the chin and the neck area. I treat the under eye area, the cheeks, the nose, the lips, the nasolabial folds, the chin, basically in the even areas between the eyes. So make sure somebody's comfortable with all of that. Number 4, they should use mostly a cannula. Cannulas, in my opinion, are much better for injectables. I use needles on occasion for certain niche items, but overall cannulas are a much better choice, so make sure that the provider is comfortable with both the cannula and the needle. Experienced injectors tend to work very efficiently and expeditiously, and they're more confident. So if you ever had somebody inject you and then you go to somebody else, you should see their injection style and just to see how comfortable they are, because more often the more experienced injector is going to be just more comfortable. The same thing goes for how they answer your questions. If they're just more comfortable answering your questions and they can answer them clearly and very efficiently, you probably have more confidence that they're comfortable doing injectables. Ask about their policy for touch-ups. So most of my clients come back to my office after they've been treated because I include what's called a touch-up policy because they purchase a procedure. Once they purchase a procedure, it enables them to come back. And I feel like that's why people get the best results, is because they can come back and add more to the area. That's one thing nice about injectables is you can do a lot of adjustments with it. And if that's included, that's a nice pearl. Find out who their supervising physician is. If the provider is not a doctor, you should know who the supervising physician is and know their level of expertise. Obviously, if they have no expertise in injectables and there's a supervising physician, something to consider. And also be careful and cautious of prices that are very lower than average, because that usually signifies there's something more to it. Their product is different, their expertise is different, so be aware of that. The most important checkpoint of all is to look at the portfolio before and after photos. This will tell you everything. If there's an extensive photo gallery that goes through all different choices and different options for treating different areas of the face, chances are that injector has a lot of experience and has a lot of focus and can show you a lot of things. So overall, the main point of all of this is to choose an injector that has a lot of experience and is comfortable and really understand that the art and the beauty of the results is truly, truly in the hands of the provider.